Dermatology, the diseases and disorders of the skin system. The skin system is susceptible to a variety of diseases, disorders, and injuries. These range from annoying but relatively benign bacterial or fungal infections that are characterized as disorders to skin cancer and severe burns, which can be fatal. In this section, you will learn several of the most common skin conditions. One of the most talked about diseases is skin cancer. Most cancers are identified by the organ or tissue in which the cancer originates. One common form of cancer is skin cancer. In general, cancers result from an accumulation of DNA mutations. These mutations can result in cell populations that do not die when they should, and controlled cell proliferation that leads to tumors. Although many tumors are benign, some metastasize, and cancers are characterized by their ability to metastasize. Sun damage. It requires about 10 days after initial sun exposure for melanin synthesis to peak, which is why pale-skinned individuals tend to suffer sunburns of the epidermis initially. Dark-skinned individuals can also get sunburns, but are more protected than are pale-skinned individuals. Too much sun exposure can eventually lead to wrinkling due to the destruction of the cellular structure of the skin, and in severe cases can cause sufficient DNA damage to result in skin cancer. When there is an irregular accumulation of melanocytes in the skin, freckles appear. Moles are larger masses of melanocytes, and almost most are benign. They should be monitored for changes that might indicate the presence of cancer. Basal cell carcinoma. Basal cell carcinoma is a form of cancer that affects the mitotically active stem cells in the stratum basal of the epidermis. It is most common of all cancers that occur in the United States and is frequently found on the head, neck, arms, and back, which are as most susceptible to long-term sun exposure. Although UV rays are the main culprit, exposure to other agents such as radiation and arsenic can also lead to this type of cancer. Wounds on the skin due to open sores, tattoos, burns, etc. may be predisposing factors. Basal cell carcinomas start in the stratum basal and usually spread along this boundary. At some point, they begin to grow toward the surface and become an uneven patch, bump, growth, or scar on the skin surface. Like most cancers, basal cell carcinomas respond best to treatment when caught early. Treatment options include surgery, freezing or cryosurgery, and topical ointments. Squamous cell carcinoma. Squamous cell carcinoma is a cancer that affects the keratinocytes of the stratum spinosum and presents as lesions commonly found on the scalp, ears, and hands. It is the second most common type of skin cancer. The American Cancer Society reports that 2 of 10 skin cancers are squamous cell carcinomas, and it is more aggressive than basal cell carcinoma. If not removed, these carcinomas can metastasize. Surgery and radiation are used to cure squamous cell carcinomas. Melanoma. Melanoma is a cancer characterized by the uncontrolled growth of melanocytes, the pigment-producing cells in the epidermis. Typically, a melanoma develops as a mole. It is the most fatal of all skin cancers. It is highly metastatic and can be difficult to detect before it has spread to other organs. Melanomas usually appear as asymmetrical brown or black patches with uneven borders and a raised surface. Treatment typically involves surgical excision and immunotherapy. The ABCDE for early diagnosis. Doctors often give their patients the following ABCDE mnemonic for help with the diagnosis of early stage melanoma. If you observe a mole on your body displaying these signs, consult a doctor. A is asymmetry. The two sides are not symmetrical. B is borders. The edges are irregular in shape. C is color. The color is varied shades of brown or black. D is diameter. It is larger than 6 millimeters or 0.24 inches. E is evolving. Its shape has changed. Some specialists cite the following additional signs for the most serious form, nodular melanoma. E is also stands for elevated. It is raised on the skin surface. F is for firm. It feels hard to the touch. And G is for growing. It is getting larger. Albinism. Albinism is a genetic disorder that affects completely or partially the coloring of skin, hair, and eyes. It is primarily due to the inability of melanocytes to produce melanin. Individuals with albinism tend to appear white or very pale due to the lack of melanin in their skin and hair. Recall that melanin helps protect the skin from harmful effects of UV radiation. Individuals with albinism tend to need more protection from UV radiation as they are more prone to sunburns and skin cancer. They also tend to be more sensitive to light and have vision problems due to the lack of pigmentation on the retinal wall. Treatment of this disorder usually involves addressing the symptoms, such as limiting UV light exposure to the skin and eyes. In vitiligo, the melanocytes in certain areas lose their ability to produce melanin, possibly due to an autoimmune reaction. This leads to a loss of color in patches. Neither albinism nor vitiligo directly affects the lifespan of an individual. Changes in skin coloration. Other changes in the appearance of skin coloration can be indicative of diseases associated with other body systems. Liver disease or liver cancer can cause the accumulation of bile and the yellow pigment bilirubin, leading the skin appearing yellow or jaundice. Tumors. Tumors of the pituitary gland can result in the secretion of large amounts of melanocyte-stimulating hormone, or MSH, which results in a darkening of the skin. Addison's disease. Addison's disease can stimulate the release of excess amounts of adrenocorticotropic hormone, or ACTH, which can give the skin a deep bronze color. A sudden drop in oxygenation can affect skin color, causing the skin to turn initially ashen or white. A prolonged reduction in oxygen levels, dark red deoxyhemoglobin, becomes dominant in the blood, making the skin appear blue, a condition referred to as cyanosis. This happens when the oxygen supply is restricted, as when someone is experiencing difficulty in breathing because of asthma or a heart attack. However, in these cases, the effect on skin color has nothing to do with the skin's pigmentation.